Hi everyone, welcome to the training course of the collaborative and development of the health system, how to strengthen the capacity of the public health personnel during COVID-19 pandemics. So, today I will talk about the collaborative and development of the health system in terms of the basic knowledge. This is the outline of these topics. So you will learn about what is the health system, the goal of the health system, the health system frameworks proposed by the WHO, a well-functioning health system, and how to strengthen the health system, and what are the challenges and opportunities of the health system. And the last one is the collaborative health system. What is the health system? It consists of the organizations, people's actions, whose primary intent is to promote, restore, and/or maintain health. It includes the people, institutions, resources, while responding to people's legitimate expectations and protecting them against the cause of the ill health through a variety of activities. What is the goal of the health system? Improving the health and health equities in the ways that are responsive, financially fair, and make the best or most efficient. The rules from inputs to the health outcomes is through achieving greater access, tools, and coverage for effective health interventions. To achieve health system goals, I mean the organizations, peoples, or institutions, healthcare workforce have to provide services, develop health workers and other key resources, mobilize and allocate finances, and ensure health system leadership and governance. The functions that were identified in the World Health Report in 2000. They propose a set of the 6 essential building blocks. This slide shows you about the WHO health system frameworks. It includes the system building blocks, including service deliveries, health workforce, informations, medical products, vaccines and technologies, financing, and leaderships and governance. These building blocks will help to access tools and coverage for the health systems and provide them with the quality and safety. And the overall goals and outcomes of the health system is for improved health. It responds to the need of the peoples and provide the social and financial risk protections and improve the efficiencies of the health systems. This slide I will give you more details about the system building blocks. First is the good health devices. It refers to the delivers effective, safe, qualities, personal and non-personal health interventions to those who need them, when and where needed, with the minimum wave of resources. The second box is a well-performing health workforces. It works in ways that responsive, fair, efficient to achieve the best health outcomes. For example, there are sufficient numbers and mix of staffs fairly distributed. So you have to concern about the competence, responsive, and productive of healthcare workforce. The third box is the well-functioning health information systems. It ensures the production, analysis and dissemination and the use of reliable and timely information on the health determinants, health system performance, and health status. So it's very important for the health information system that are reliable and timely informations. The fourth box is a well-functioning health system. It ensures equitable access to essential medical products, vaccines, and technologies to ensure the quality, safety, and efficacy and cost effectiveness. The fifth box is a good health financing systems. It lies adequate funds for health in way that people can use needed services and are protected from financial risk or impoverishment associated with having to pay for them. The sixth box is a leadership and governance. It involves ensuring strategic policy frameworks exist and are combined with effective oversight, coalition building, the provision of appropriate regulation and incentive, attention to system design and accountabilities. These are some design attributed for each building block. First is a multiple dynamic relationship. A health system is a set of the interconnected parts that must function together to be effective. You will see changes in one area have repercussions elsewhere. Improvements in one area cannot be achieved without contribution from the others. Interactions between building blocks is very essential for achieving better health outcomes. Health system strengthening. It defines as improving these 6 health system building blocks and managing their interactions in ways that achieve more equitable and sustained improvement across the health services and health outcomes. It requires both technical and political knowledge and action. Access and coverage. Since the notions of improved access and coverage lie at the heart of these health system strengthening strategies, there had to be some common understanding of these terms. Progressing being made a key concern of the governments and others who invest in health system is hard to tell whether and when the desired improvement in health systems performance are being achieved. Convincing indicators is very needed because they can detect change on the ground. A well-functioning health system, it responds in a balanced way to the population needs and expectation by improving the health status of individuals, families, and communities, defend the population against what threatened its health, protect people against the financial consequences of ill health, provide equitable access to people-centered care, and the last one is make it possible for people to participate in decisions affecting their health and health system. Health system strengthening. It is the process to identify and implement the changes in policy and practice in the country health system so that country can respond better to its health and health system challenges. The health system strengthening initiatives and strategies that improve one or more the function of the health system, lead to better health through improvements in access, coverage, qualities, and efficiency. What are the challenges and opportunities of the health system? As the spectrum of the ill health changes, so health systems have to respond. Their capacity to do so is influenced by various factors. Some health policy challenges are primarily of the concern to low-income countries. The impact of aging populations, the provision of chronic disease or chronic care, or provide social security reform are no longer the concern of industrialized countries alone. The threat posed by new epidemics such as avian or human pandemic influenza, also right now the COVID-19 pandemics, require a response from all countries, rich and poor. And also given the size of the global spending on health and concerns about health systems performance, the question is why are not health systems working better? The health system need the collaborations. I already mentioned about the meaning of the health system, right? It's that consists of organizations, people's actions, whose primary intent is to promote, restore, and maintain health. It includes the people's, institutions, resources, arranged together according with the established policies to improve the health of the people. The powerful change will come from the cooperation of the people, organization, and various sectors. Provide opportunities for individuals and organizations to exchange information is very important for collaborative health systems, including lessons, experiences with people or outside organizations. Build collaborations and work together in a manner that benefits each other is the major key of the collaborative health system that allow the organization to operate in harmony, to have a great common goals and understand each other's roles and responsibilities. Now, I will give you more detailed definition of the collaborations. It involves multiple people interacting to achieve a common goals. The other peoples also give the definitions. It is a process that involves cooperation, communication, negotiation, trust, respect, and understand to build a synergistic alliance that maximizes the contribution of each participation. Leaf and their colleagues identified the collaboration as a process of working together, negotiating agreements, and managing conflict, and both varying and understanding on another's. Another colleagues define the collaboration as the involvement of working together, share planning over time, and functioning cooperatively as a colleagues and equal with respect, and a view to find a solution together. So we need work together, solution together. For summary, what is the collaboration? It is an integration of activities, knowledge, that requires a partnership of the shared authorities and responsibilities. When we look at the definition, in the collaboration in healthcare. It refers to a coordinated team activities in which members with various knowledge, skills, or capabilities work together to conduct a task for meeting the shared targets. The collaboration usually occurs when a group of autonomous stakeholders of a problem domain engages in an interactive process, using shared rules, norms, and structures to act or to decide on issues related to that problem domain. Collaborative healthcare can address the growing expectation of healthcare users, current healthcare challenges, such as an increase in chronic disease and population aging. Both of them require of the greater collaboration among healthcare actors to be properly addressed. What is the quality of the collaboration? It's bringing together healthcare stakeholders to achieve common and improved objectives is a key for healthcare improvements. Collaboration may result in optimizing the development of resources, enhancing communication, coordination, and consequently, a better healthcare performance. So I will give you example in terms of the collaborative health system in the community. Yes? We can call integration in the community health system. Integration is a concept used for expanding the relationship among participating units within community health systems. It aims for a better efficacy and efficiency of the system. The community health system, primary health care, primary health services, and integrations are all related in terms of their values in creating healthcare processes to make the people healthy and healthy societies, which is the optimal goals of the community health system. Community health system is the Thai health ideologies based on the concept of the primary health care. And primary health care refers to a whole of the society approach to health and well-being centers on the needs and preferences of the individuals, families, and communities. Primary health care provides whole person care for health needs throughout the lifespan and to ensure people receive comprehensive care ranging from promotion and prevention to treatment, rehabilitation, and palliative care. So, integration in the health system means the harmoniously combining of peoples, groups, organizations, knowledge, technologies, and so on related to health in order to create the cooperation at various levels in managing the health system, leading to the change in lifestyle behaviors, which in turn lead to the well-being in the target population. The integration in the health system focuses on the harmony among each integrating participants. So I think collaboration or integration in the health system is very important. It will create the harmony among each integrating participant. Why I show you this slide? Because Thailand got the best healthcare system in the world. I mean the sixth ranked best healthcare system in the world, based on the CEO World magazine ranking. So when we look at the component of the evaluations of these rankings, you will see that They look at for the health infrastructures, health professionals, healthcare costs, and availability of medicine or health equipment. This component is related to the six building blocks of the WHO health system frameworks, right? Okay. Okay. For the last slide for these sessions, I would like you prepare yourself for the discussion on June 23rd. I would like you to think about why Thailand is got the second length of the country by the recovers. This slide I prepare for you on the discussion session for June 23rd. I would like you to look for the reason why Thailand got the second rank of the country in the world that has the high recovery index. Thank you very much for your attention and see you again on June 23rd for the discussion sessions on the health system and collaborative health system. Thank you very much again.